Our talk is obviously going to be a day-in-life medical student, just like a brief overview, essentially, of what medicine actually entails from a perspective of a medical student. So we're going to start firstly what type of courses there are. Obviously, in medicine, you come into it believing that it's going to be just lectures or you have some placement and stuff like that. But every medical school has a different way of teaching. Some use PBL-based teaching, whereby you actually are in smaller groups and you actually learn based on a problem that is being discussed. And also, normally they'll take like a condition, for example, and they'll say, okay, so today we're going to learn about heart failure, and they'll learn everything about heart failure in the smaller groups, and that way you actually kind of compromise all your learning into like the more specific conditions rather than learning a series of lectures about all of the human body and then trying to piece everything together. Some universities learn by system-based, so this is whereby you actually go through the system as you've done like A-level and stuff like that. So where you learn about your cardiovascular, your respiratory, your neuro, so other systems essentially by you doing order. So you kind of like comprise all your knowledge in just one system, so you become really good at that system, and then you move on to the next one. Obviously, you have to be revising for the whole year to maintain that. And then other universities do traditional way of teaching, whereby your years, so whether it's 5 or 6 years, is split into your preclinical years and your clinical years quite strictly. And other universities like Southampton does an integrated method of teaching, whereby our years are still split into preclinical and clinical, but even in our preclinical years, we still have early patient contact and placement. And then in our clinical years, it's all full-time placement, essentially. So, yeah.
Cool. So has the slide changed?
Yeah.
Perfect. Cool. So I'll quickly touch on like a brief overview in terms of the preclinical years then. Specifically to Southampton, but the general principles will apply to other medical schools as well. Starting at Southampton, so there are 2 main undergraduate medical programs. So you've got the BM5 and the BM6 course. And then you've got the BM4 course, which is kind of graduate level or graduate entry medicine. So I'm talking predominantly about the first 2. So the BM5 course is sort of your traditional 5-year, and then the BM6 is your foundation year included. So kind of like a gateway program for widening participation students. So the year 0 year is only applicable to that gateway program, and you do sort of 2 modules, so human structure and function, so that's all your science, your anatomy, your physiology, and then also professional practice, so that's when you kind of go on placement, and they're observational placements in GPs, hospitals, physios, you name it, there's probably a placement there to kind of give you further insight into how the NHS works, and also how you can kind of practice as a clinician in the future. If you go onto the BM5 program and also obviously the second year of the BM6 program, you're then looking at doing foundations of medicine, respiratory, cardiovascular, and the locomotor module. So as Org was saying, that's kind of like your sort of systems-based sort of teaching, but because we're integrated, we also have cases and things throughout to help us with our learning. And then in your year 2 year, that's when you kind of follow through with the renal module, which is a continuation of that respiratory cardiovascular module, nervous and locomotor, and then GI, endocrine, and the life cycle. So by the time you finished year 2, you should kind of feel confident going into placement from an academic standpoint. They're actually really, really interesting modules, and I love the fact that you get to do anatomy. So we do dissection, so we'd be in the labs with the cadavers of the specific area that you're learning about, and kind of going into the anatomy in a bit more detail. And then you have like pharmacology lectures, tutorials, same with pathology, and it brings everything together. So by the time you start placement, you've got like a really good foundation of medicine. We also have early patient contact, so that means every fortnight you get to go on placement, whether that's a GP, hospital, and it lets you sort of build up your confidence in your communication, talking to patients, which is really exciting and kind of keeps you going. And then lastly, we also have humanities kind of integrated within the course. So it kind of gives you a break from all the hard science that you've been doing. And it's really nice to be able to do different things, whether that's music, art, creative writing, that's kind of linked to medicine, but not directly teaching you sort of like the basics that you need to be a doctor, but rather giving you a broader insight into the profession.
So we then move on to the research projects and intercalated years. So in year 3, in the first semester, we do a research project that is compulsory for all Southampton University students. And in that semester, you get to basically pick a research topic, or a research field of your choice. So therefore, all the specialties of medicine you can imagine, they probably have a research project in that. So whether it's surgery, whether it's GP, whether it's pediatrics, whether it's anesthetics, they have research projects within those fields. So it's a good time for you to actually explore a field of medicine that you might be interested in, or just have some sort of inclination towards. And then within that field, you then actually choose a specific project itself. So for example, I did my research project in GP, looking at how people can recover from fibromyalgia, which is a chronic pain condition. And you do essentially spend about 4 months working on this with your supervisor and your supervisory team. And it's actually really, like, quite good fun actually, because it breaks up the transition between preclinical and clinical quite nicely, and also gives you a chance to actually, like, to put your hands onto a bit more research field, because essentially in medicine, once you're a doctor, it's not just about practicing being a clinician, but you can actually get involved in research and actually take up these opportunities as well. Because it's actually a research project and it's a recognized research project, you have to get classification out of it, and so definitely get an extra degree essentially to your name. So you come out at the end of your 5 years with 2 degrees. One would be your BMed-Sci, which is a research project, and the other would be your BMBS, which is your medical degree. So it's always in your CV as well. After year 3, at the end of year 3, you can choose to do an integrated degree between year 3 and year 4. So that's what medicine did. So she'll talk about more about that as well.
Cool, yeah. So you might have heard the term like intercalated degree being like thrown around, and a lot of medical schools offer it, but the great thing about Southampton is basically you decide if you want to intercalate during the degree, so it's not a compulsory thing like some other medical schools, and you can kind of take an extra year out to just do something a little bit different. You can stay at your current medical school or you can go elsewhere. So I decided to stay at Southampton and do a master's. So I did a master's in medical sciences. So that's like really research heavy. You kind of create your own research project, or you can join an existing one. And it kind of lets you see research from a different side with a longer period of time, which I really enjoyed. So I did mine in medical education. Specifically within widening participation, because that's something I'm really interested in, really passionate about. And I think it gives you some extra time to do it. Whereas if I was on placement, I would have, it would be kind of hard to juggle it all. So it was kind of nice to have a year out to be able to do that. There are obviously bachelors that you can do as well. So some people decide I'd like to go to a new medical school, get a different experience for the year. You obviously have to come back at the end. And by doing a bachelor's, you can kind of get insight to maybe an area of medicine that you're specifically interested in. So some people do bachelor's in sort of like anesthetic, surgery, global health, peds. And it means that if you maybe think, oh, in the future, this is an area I'd like to go into, you can experience it from an academic standpoint before you sort of commit to the training pathway. Intercalated degrees, as well as obviously the academic benefits, there's obviously social benefits as well, whether that's meeting new people, gaining new experiences, networking. And I think Southampton does that really well because everybody does the BMed-Sci project that Augustine talked about. So we all kind of have that sort of like basic understanding in research. So then if you sort of get interested in it at medical school or even before medical school, you can kind of pursue it at a greater level. It's also a great time to pursue like your own hobbies and just kind of do things that maybe you didn't have time for whilst you're on placement. There are also professional development opportunities. So we just noted down that there's loads of opportunities to go to medical conferences, and that's just kind of talking to other doctors, other researchers in the field, finding out a little bit more about what they do, but also showing off what you've learned throughout the year as well. And just having a little bit more time to do that is really helpful. And there's also publication opportunities. So looking at journals and things like that, it's really nice to be able to have some more time to kind of sit down and write. So that's what I'm spending my time doing now, and getting like really detailed feedback that I think having that experience really helped me with. So that is the research project and Intercalated Years in a nutshell. And it's a really unique opportunity that doesn't suit everyone, but it's definitely nice to have the option there to consider.
Okay, so transitioning quite nicely from that, actually, since that's between year 3 and year 4. If you do Intercalate, you then come into year 4 to do your other parts of your clinical years, but your actual clinical years does start from your semester 2 of year 3 in Southampton, all the way to end of semester 1 in year 5. So essentially, the way it actually runs is that from January of year 3 till January of year 5, so a 2-year period, that's all your clinical years done. That's where you do all your specialties, all your normal placements, your ward rounds, your GP, it all occurs in those moments. In Southampton, we do our placements in this way. So we do in year 3, you do medicine, which includes your cardiology, your respiratory, your neurology, and also elderly care, so geriatrics. We also do surgery, which includes the orthopedics or cardiothoracic or breast and plastics, GI, so many different types of surgery. And then we do primary medical care, which is essentially GP and looking at more long-term conditions in the management, so like diabetes, COPD. With all these placements, it's 8-week blocks, and you tend to be in different groups within that as well. We do travel a little bit in terms of where we get good placements. So, for example, I traveled for about 45 minutes each way for my placement when I was in year 3, but essentially, as you get later on in the years, you do tend to travel a little bit more further out as well. For example, in year 4, you can actually stay on site for your placement. So people actually go out of Southampton all the way up to Guildford, and even up to Slough, essentially, and you actually stay on site for your placements. In year 4, we do more specialist placements. So we do like specialties, which is dermatology, ENT, ophthalmology. And then we also do acute care, which is basically emergency medicine and anesthetics. We do obs and gynae, which also includes sexual health. So we look at more like sexually transmitted diseases and STIs. And we also do child health. We actually go to visit schools and stuff like that. And we do psychiatry, which is a wide range in terms of what you actually cover. So from community psychiatry to more you can even do like prison psychiatry, you can do more elderly care psychiatry or child psychiatry. And then in year 5, all the placements you did in year 3, you repeat them again in year 5, but this time the level of understanding you have is greater, and also the level of expectation from the doctors and the nurses are also greater on you. So therefore, you would be responsible, you'll be a lot more responsible anyways, compared to the previous years. And also, essentially, what they will ask of you is on a much higher level because you're preparing to be transitioning to an F1. So therefore, that's why they revisit those placements again. And then at the end of year 5, or in January of year 5, once you've done your final exams, we then look forward to your elective period. Elective is basically an 8-week block, or currently 8 weeks. We'll see how things go, whereby you have the opportunity to go and visit another country and see how medicine is practiced there. And we have a wide range of countries that you can visit. I think there's very, very few restrictions that we have essentially, and you can split it between more than one country. So like quite commonly, people tend to go to Asia, to go to Africa, to go to South America, North America, essentially just places where they haven't been before, and also places where they have an interest in whether they want to work there in the future or just want to visit there just for their own personal reasons as well. So it's a really good opportunity, and it's a much more relaxed placement essentially. So you don't have to be as responsible. So therefore, people actually take that time to actually take the time to learn things, new things, explore new conditions they've never seen before. For example, visiting Caribbean, you might see more tropical conditions that you don't actually see in this country. So you actually have some enhanced knowledge overall. Elective is always a brilliant time for every medical student, but every medical school does it at different points within their course. I know, for example, a place like Manchester does it at the end of year 4, before your final year, and other places do at the end of year 3. So it all does vary quite a lot.
Yeah, definitely. But add on to that, the fact that is at the end of the degree, it's almost like a celebration of all your achievements. So it's something that we're definitely looking forward to. And like the placements sound like really intimidating, but they're actually so interesting. You get to see a broad range of things in medicine. And so I did the 4 year, but obviously Augustine had a different year slightly, which I'll ask him about because of COVID. But in terms of my experiences of year 3 placements, they were really good, really interesting. There's this balance between being a student, so the clinicians and the allied health professionals are there to kind of teach you, give you insight into how to manage patients, what they would do if that was their patient. But then there's also the flip side of the expectation that they will be like, kind of have a go. What do you think we should do with this person? They might ask you to sort of like take bloods or put a cannula in, and you build up those clinical skills right from the get-go. And it's really like encouraging, because you start off your placements and you're probably like a lot less confident. But by the end of the year, I felt sort of so excited to kind of go into the next year. And that actually contributed to my reasoning to wanting to intercalate, because I thought I've had such an interesting time. I've learned so much. And actually I feel more confident and more prepared that even if I take a break in between my 3rd and 4th year, is not going to be to my detriment as a clinician. So it was actually really nice to gain that confidence and those skills during placement, and actually have that balance between being a student but also being a future doctor, and actually getting to be challenged in both those areas. Do you have anything else you want to add, Og?
Yeah, no, I think it's one of those things that placement as a medical student is actually a really fun time. To be honest, I had my first placement in year 3 was in GP, and I learned so much that I didn't even think was possible in a short time of 8 weeks. And it's just simply because applying what you learn and actually seeing how it's practiced in real life, and seeing how the clinicians actually manage these patients, make it really like comprehensive for us in terms of how we actually gather the knowledge, and also like they give you tips and pieces about what you should look out for and how it actually presents, translating from the books into how real patients present is actually such a cool, fascinating, really.
Cool. So, do you want me to do this, or shall I?
Okay. No, you can do this one.
Okay, cool. So obviously we've talked about generally sort of the day in the life of a med student at Southampton, and we will go into kind of the specifics at the end, but we wanted to start off with the general principles. But definitely when thinking about like what medical schools / universities to apply for, it's really important to consider a broad range of things, which we've touched upon. So starting off with that early patient contact, that's one thing that is really nice from whatever program you're on. From very early on in semester 1, you are seeing patients, talking to patients, working with GPs and hospital consultants to kind of figure out what's going on, and also what the next steps are. And that builds up confidence from the beginning of the course, which I really like. So some people prefer to be able to go into placement, having all the knowledge, and then kind of working on the communication and stuff like that later. And that's sort of like your more traditional preclinical clinical split. Whereas the fact that Southampton has a bit of early patient contact means that you feel really prepared for placement. And once you hit the wards, you're a lot more smoother and slicker than if you hadn't had that experience at all. In terms of education and research, I've probably babbled on about that a lot. So in terms of the research project, the opportunity to intercalate, the publication and networking opportunities, and also if you're into teaching or you want kind of teaching as part of your career, that research and teaching are kind of like yin and yang, and they really do align with each other. That's something I'm really passionate about in terms of education. So I had an experience in terms of teaching younger medical students during my intercalated degree, which is something that might have been a bit harder to do whilst I was on placement. And it also teaches you a lot to be able to challenge somebody else. So for students asking me questions, it kind of made me think and make sure that I kept my knowledge up to date. In terms of types of study, then that's kind of the stuff we touched on at the beginning. So the systems-based integrated or PBL, that is really important, and definitely go for universities which suit your learning style. If you're not too sure exactly if you want PBL or systems-based, it's kind of integrated is really nice because it means that you get to experience a bit of both, and both of those types of learning styles fit into your learning, which is actually really nice. And then I will leave the facility and location to Org.
So facilities, it is quite important to actually think about this as well. And I think it's one of those things that is normally more beneficial when you ask fellow medical students at that university or an open day if possible, just to see actually what they do have. And because our medical students, our medical schools might have things like a much more bigger like anatomy lab, essentially for you to actually if you're interested in dissections or intermittent surgery, you want to get your hands involved in that. Also, there's things like having your own campus, having your own library that's dedicated to medical students is actually quite beneficial, because at the end of the day, like, you do have slightly different working hours compared to normal students, and having a library dedicated to your studies actually really helps us out. So that's often like we have our own campus at the hospital site, whereby we have our own lecture rooms, our own anatomy lab. Or, we also have other facilities such as the Cancer Research Lab that's in Southampton, one of the very few in the country, which is actually quite interesting, because at the end, like in year 3 in your research, we can actually get involved in actually looking at what they do in the Cancer Research Immunology Labs, and actually if that's interest, you can actually get involved in that as well. Also, other facilities just in normal universities, whether you're thinking about sports or music or performing arts, every university has something that they cater towards. In Southampton, I know, for example, I'm a massive fan of sports, and for me, looking into university, I thought about what sports facilities there are. And Southampton has a massive, wide range of sports facilities. They definitely have about 12 different sports facilities that they have, and I feel like it actually helps you get more involved in what you actually have passion with, rather than thinking that once coming to medical school that you're going to have to drop all of those hobbies and stuff that you liked and kind of think about just your studies. But that's not true at all. You can actually balance it all. Location, this is very important. At the end of the day, you're going to be spending a good amount of years, at least half a decade, maybe more if you intercalate. And you have to think about, would you be comfortable staying here for 5 to 7 years of your life? Is it something that you're going to be always having in the back of your mind that you wish you weren't there? And also, like, the distance you're going to be traveling from your home to the university and back, is that something that's feasible for you? Is that going to be too much? And also, like, if do you want to be close to home? Some people don't want to be close to home. I personally wanted to actually move away from my home, essentially, for university, but not something that's too far. And Southampton is perfect for that, because we've got really good connections into London, and also, like, it's far enough that I don't feel like I'm that close at home. And it's definitely something that I would say, if you can, obviously, if possible, visiting the university really, really does help. And I know with this pandemic, it's kind of hard to be doing visits into university, but just having a look online, a lot of the universities have virtual tours just to see what the surroundings like, what the general vibe is like, and to see if that really suits you, really.
Yeah, cool. So we'll briefly touch on the journey sort of like beyond medical school. So obviously, as I said, like, medicine is like at least half a decade in terms of your undergraduate medical training. But it's nice to have a little bit of insight into sort of like thinking beyond that, and sort of like how medical school helps you with that. So the first bit that we referred to was the foundation year. So when you graduate, if you decide to practice straight away, you become an F1. So that's foundation year 1, and then you progress into F2. So the nice thing about going on all these different placements, it's almost like you're finding a little bit about everything as a medical student. Foundation years is similar, so you find a little bit about everything as a doctor. So you're practicing in various different areas of medicine, and surgery, and it means that you get a bit of an insight into how it feels in terms of the work-life balance and things like that, and also kind of building up your CV in terms of showing off that you're interested in that certain field of medicine. And then after that, you kind of go into sort of like deciding to specialize. So there's 2 different things. So the run-through pace is basically getting a job in a certain area and kind of going through that whole thing without reapplying and without going into a slightly different area. Whereas the core specialty training is kind of like you do, you're kind of like the med reg or registrar in that area, and you rotate around all the different areas, so cardio, rest, gastro, etc., before then stepping into the higher specialty training of your area. So having sort of like a brief insight into what happens after medical school is really important in terms of in medical interviews, but also is important in terms of knowing what you're kind of signing up for, and picking a medical school is sort of like the first step, but it lends itself towards the rest of your career really, and all the networking or the research or the teaching does feed into your applications for the future steps. So it's really nice to have a medical school that allows you to kind of build up your CV as you go along, and I think that's something Southampton does really well. Is there anything you want to add, or is that me?
No, I want to ask you a question. What specialty are you considering post-medical school?
And so I'm a very indecisive person, so I'm not 100% too sure, but I realized I'm kind of like a generalist type person. So the specialties that I'm thinking about are sort of like emergency medicine, general practice, pediatrics or geriatrics. So basically the ones where you get to do a little bit of everything. And I think the placements are coming up this year. So this year I'm going to be doing emergency medicine placement, also going to be doing pediatrics, and I did geriatrics and general practice last year, because hopefully will help me in my decision making. So it's nice that you get placements in the fields that you're considering. How about you?
I'm quite similar in terms of I like the general stuff really, and also I like to go for everything. For me, patient contact is something that I always loved, and I loved in medical school. So because of that, I'm more inclined to be going into the field of GP. But I have a massive love for sports, and therefore I might be combining it with sort of GP with sports medicine, which is quite a niche field, but something that is around and it is there, and I would like to do that in the future.
And the thing about medical schools, also just adding on that point, is we have loads of different medical student societies. So as well as your main university ones, with all the sports, arts, etc., we have those as medical students, but we also have professional ones. So if there's something that you're into, there's probably an academic society for it. So there's a general practice society, there's a sports and exercise medicine one, there's pediatrics, anesthetics, and you can kind of get involved within the committee, but also just go to the events and hear like careers talks, get sort of like certificates to show that you're interested as well. And it's definitely something to think about, like looking at medical schools that have societies with things that you're interested in, because it means you can get involved once you're there.
Is that the last slide?
I think that is, yeah.
Okay. So we're just going to finish off by, as the title said, a day in the life of medical student, literally giving you a breakdown of an hour-by-hour play of how a typical day would be. So I'm going to do a preclinical day, and Melissa's going to do a clinical day, essentially. So preclinical day, so year 1 and 2. So a typical day, let's pick a day. You would start lectures at 9 a.m. Most people, they start at 9 a.m. You could have an hour lecture, so 9 to 10, in pathology. You might then have a 2-hour lecture in anatomy, so you can have a 10 till 12. You can then have a break, so a lunch break, so 12 to 1. So therefore, you have like, you can go off to do your own thing. And then 1 till 2, you can have a tutorial, which like consolidates what you've been learning in the previous week as well. So you can have a tutorial on pathology as well. And then you can, from 2 till 4, you can have another 2-hour lecture, 2 to 5, you can have a symposium, which is quite common actually. So symposium is basically where you have like a bigger topic and actually to discuss all the aspects of that condition in a much more broader sense. So you have all the medications for it, so the pharmacology, the anatomy, the physiology, the pathology, all of that combined in that condition. So you can have a symposium on COPD, for example. So whereby you look into the medication for it, how you treat it, how you manage it, how you diagnose it, and what investigations you do, what happens in terms of the body, the anatomy behind it, and exactly what physiological changes happens in that condition. And then afterwards, so around 5 p.m. you finish your day, and then 5 to 6 you can go home, head home, or just stay in there to do a bit of extra reading. for me, I love playing sports, so I joined the basketball society. So therefore, in the evenings, I tend to train or play matches. So for me, between 5 and 7, I'll go home, essentially decompress, and then eat, and then head out to my training. So from 7 till 8:30, I train. So therefore, I have my basketball matches or training days incorporated in that, which shows that at the end of the day, like, I can still balance being able to like have your lectures and also be able to continue your hobbies and stuff like to help decompress and also like take your mind off things. You can't be in full-time medical mode essentially all the time, because that's not exactly healthy either. And then I'll come home around 8:45. I could then obviously get ready, like essentially shower and stuff like that, and then from 9 till maybe 10:30, 11, I could then do some reading to, as I consolidate what I've been learning throughout the whole day, or just make notes on what I didn't understand, and that will essentially be my day. What about you?
Cool. Yeah. So in terms of the clinical years, your timetable is a little bit more erratic in the sense that it's still mostly Monday to Friday, maybe like 8 to 6 or 9 to 5 kind of thing. But the main difference is that there might be occasional weekend shifts or night shifts based on what your learning needs are. So starting off from a typical day, so let's take like a medicine placement, for example. The ward rounds normally start at 9, so I'm kind of like an early bird, so I normally go to the gym in the morning. I can't do any exercise once I get home, so I don't know how Org does that at all. So I would normally go to the gym in the morning and then shower at the gym, head to the hospital for the ward round at 9. So the ward round just kind of involves following consultants, registrars around and kind of seeing the patients. They might ask you some questions. They might ask you what you want to do with them. You can like take their bloods, that type of thing. And that would normally last for a couple of hours. So let's say about 9 to 11 would be the ward round. Then everyone has a break, gets a cup of coffee, has a chat. Before then, all the juniors and the seniors sort of splitting off. So depending on the day, sometimes you might be with the consultants. They might give you a bit more formal teaching or formal assessments. Or you might be with the juniors and they might be teaching you sort of like the main skills, like putting a catheter in or taking bloods, or just kind of giving you sort of like general advice and things like that. So then that takes you up until about lunch. In the afternoon, most hospitals will have their clinics, or if you're in surgery, theatres, and you're able to attend those to kind of build up your knowledge and see things from a different perspective as well, rather than on the ward, because sometimes some patients can kind of obviously go home and they'll just pop in, see the consultant, and you'll be there as well. That normally takes you till about 5 o'clock, 5, 6 o'clock, depending on how busy it is. If you're seeing patients by yourself, that typically takes a bit longer because people love telling you about things. And that's really nice though, because we get sort of like an insight that maybe their clinician might not have seen before. And then after that, I go home, grab some food. I might go out and see friends. I might go out and do some notes at the library. I might just, completely switch off and just have Netflix on. But the important thing is that I know when to prioritize. So if I've got like an assignment coming up, or I've got an assessment coming up, then I need to kind of focus on that. If I feel not that confident about something, I can kind of type up some notes or watch a revision video on it. But if I'm feeling okay, then I can kind of just take some time off to switch off from everything. And I'm not as sports-based, but I definitely get involved in loads of teaching societies. So some nights I'll be on campus teaching younger medical students, or going to like careers talks and things like that. So it's really nice that you can kind of mix and match things. And for anyone worried about work-life balance, it's definitely achievable to have both. You shouldn't be, and most people don't last if you're just focused on the degree all the time. You'll burn out. You need time to kind of do things, meet different people. Before COVID, both of us were student ambassadors. So we kind of go to schools or have schools come to visit us on campus. And it's a great way to meet people studying different courses. And it's also a great way to kind of just switch off from the degree and have some fun, make some money. and also do things that you wouldn't really do on placement. So there's a wide breadth of experiences there, and definitely don't worry about kind of like giving up your passions or thinking that you're just going to be stuck in a library all day, because that's not the case.